Again, my name is Matthew Menendez with White Plume, and this webinar is really designed for existing White Plume clients who are interested in AccelaMOBILE. AccelaMOBILE is designed to capture charges outside of the office. So if you have doctors that are going to a surgery center, rounding at the hospital, seeing patients at the nursing home, that's really what this is designed for. What we heard when we talked to clients about hospital charges or charges away from the office, they said it makes them want to pull their hair out, and not in the cute way like this. It look, they say it looks something more like this. And what makes it so frustrating is that charges are easily lost. It's hard to track those down. You've got doctors that are going out there. They may be going to multiple hospitals, capturing this in a paper-based process, sticking it in their pocket, and those don't show up till the end of the month. That makes things very, very difficult. It's hard for the doctor, and it's hard for the billing team to make sure that they're capturing all of the charges and doing that in a timely manner. And particularly for clients who've automated this process in the office, they're still having to do manual charge entry to key those charges into their billing system. They're also having to review all of those, sometimes their highest dollar value charges, reviewing those manually rather than having them go through AccelaSmart to review all of the rules. That's where AccelaMOBILE comes in. So let me give you kind of the big picture view of what this looks like. Everybody on the phone today should have either AccelaPass or AccelaCapture is what they're using to capture charge data. So AccelaCapture is obviously the electronic super bill that makes ICD-10 very, very easy for the physicians. AccelaPass is for our clients who are capturing all of their charge data through their EHR. Regardless of how those charges are captured, they flow into AccelaSmart. Right? AccelaSmart allows you to review all of the charge data, make sure it's coded correctly, only touch the ones that have problems, build in things like custom rules that are specific to carriers. That's very, very important today in ICD-9, and will be even more important as we transition to ICD-10 this fall. Once those are reviewed, corrected, completed, they go out across the HL7 interface to one of the practice management partners. Right now, obviously, we don't have all 42 interfaces listed there, but chose the ones that are most popular in our client base. Okay, AccelaMOBILE is a third way to capture charge data. It does not necessarily replace AccelaPass or replace AccelaCapture. It is an alternate charge capture method for certain types of encounters. Once those are captured in AccelaMOBILE, they'll be transmitted to AccelaSmart and use the same interface with your billing system that AccelaCapture and AccelaPass are using today. So just to kind of run through some of the characteristics of AccelaMOBILE before I get in and show you how it works, is it's a web-based application. That means that there's nothing to install for your providers. They can use whatever kind of device they want, so long as it is a web browser. So PCs, Macs, laptops, desktops, tablets, iPads, Androids, iPhones, anything that has a web browser will be able to securely access AccelaMOBILE. That's nice because you don't have to keep up with all the doctor's devices, and the data is not stored on their device either. It allows access for all of the people who need it. So not just for your providers, but the billing team is going to have immediate access to that information as well. The idea there is so that they are not waiting for the doctors to drop off the charges, and the doctors aren't responsible for that. They can see their patients, they can capture the data on the device that's in their pocket or at a nursing station at the hospital, and as soon as they're finished, those charges are available to be batched in AccelaSmart. So just like you pull in charges from AccelaCapture or AccelaPass today, you can pull in those charges from AccelaMOBILE. And you can use multiple charge capture methods. So if you have some doctors that are using AccelaCapture, other doctors that are using AccelaPass, and then some from each of those groups who need AccelaMOBILE, you can mix and match those as necessary. What that means is that all charges, regardless of where they're captured, will run through AccelaSmart before they post to your practice management system. So you automate the charge entry process, and you automate the coding review process. And if there are additional custom rules that you need to be built for AccelaMOBILE, you can build those into AccelaSmart just like you do today. There's no new interface required with your practice management system. We use the same HL7 interface that is already in place. For groups that have remote charge capture problems, AccelaMOBILE is a very, very good solution. What we've learned from our existing clients that have moved over to AccelaMOBILE is that the key to making this work, the key to making AccelaMOBILE work is to make it easy for your physicians. So that we're not asking them to do anything in addition to what they're doing today. Okay? If we can do that, you can deliver some significant results. Let me share just one client story with you. A group that took their internal medicine service, brought them up on AccelaMOBILE, and what they did was they were able to increase their net revenue by almost $6,000 a day. It's very, very significant for them. They were missing charges because scraps of paper would go into the doctor's pocket never to return. And instead of getting those nearly 3 weeks later, they were able to cut that charge lag down to just 3 days. Automate the charge entry process, automate the coding review process to deliver significant financial results. But remember, we have to make that easy for your providers. Don't ask them to do more than what they're doing today. Try to make that workflow fit within what they're already doing. Okay? So remember how this fits in. It's another charge capture source that's really designed to capture remote hospital charges. So let me walk through this, and I'll show you what I'm talking about, how it works. I'm going to pull it up just on my web browser in Chrome, but you can use any browser, you can use any device. That's just what I'm going to use today. So I'll go out to the site. You'll notice it's HTTPS. It's a secured, encrypted site. So all I need to do is I'm going to type in my username, and I'm going to type in my password here. So I can do this from anywhere that I've got an internet connection. It brings up my list of patients for Dr. Menendez at Lake Forest Hospital. Now, obviously, I could change that if I was seeing a colleague's patients for the day. I can add that to my list. If I want to go to a different hospital, I can add that to my list. But what you'll see is my list of patients. I've got it sorted in descending room number to make that very easy for me. You can see I've already seen Minnie Mouse today. It's marked as completed. That means that particular encounter is available to be batched in AccelaSmart right now. It'll turn to batch and will be read-only once a billing employee picks it up. So let me walk through a couple encounters and show you how it works. When I'm ready to see Mr. Elway, I'm going to click on Copy Last, this blue button here, and what you'll see is it pulls in the diagnosis codes and procedure codes from the most recent visit. The most simple example is when nothing has changed. I'm going to use the exact same CPT and diagnosis codes from the prior visit, and I'm going to click Save and Complete. So it's 2 clicks for me, and I'm done. I click on Copy Last. I click on Save and Complete. I'm finished. Now, everything is not going to be that simple, that straightforward. So let's look at another example. Again, I'll hit Copy Last. I'll start with the codes that I used from the prior visit. But you'll notice that this was an inpatient admit. And let's say I can't use that again, right? I can only do that once. So I'm going to click on the red X. It'll wipe out that line item. Click on the green plus, and it'll bring me to my CPT favorites list. This favorites list is customizable, and you can customize that down to the provider-specific level. So if I have a level 2 subsequent visit, I can click directly on the text. It brings that back to my summary screen. If I want to link the diagnoses to the particular line item, I can do that. Again, if a provider forgets to do that, it will be caught and corrected in AccelaSmart. Once I'm finished, again, I can hit Save and Complete, which brings me back to my rounding list. Now, what happens if a patient that I need to see is not on my rounding list? What am I going to do? Well, up at the top, I've got patient search, and this does two things. It lets me search for existing patients, but if there's not anyone that's found, it allows me to create a temporary patient so that that patient can be registered in my PM system, assigned a patient ID, so the charge can be posted. So let's say, for example, that I was looking for a patient with the last name Newton, or sorry, typo, Newton. When I hit enter, it brings me all of the search results. Now, maybe the patient that I'm looking for is not listed here. So that you see where it says I can't find who I'm looking for, I can create a new patient. I can do that right here. Okay, so it's trying to prevent me from entering duplicate information, but also when I hit create new patient, it already retains the information that I had already put in, right? So let's say that it was Robert Newton. Maybe I'll put in his gender. Maybe I'll put in a birthday of, let's say, March 18th, right, of 1964. I can put in that information. I can go ahead and create the patient. I may go a step further. I'm going to put in his room number, right? And what that'll allow me to do is remember where he is for the next day, so it'll be easy to come back and see him again. And I'm going to hit create. What that does is it brings me to that encounter summary screen. Now you'll notice it has this expanded section open and available for me. I can toggle that open or closed as I see fit and allow me to add a referring physician, add an admit date, change the location, enter a billing note if there's something that I want to communicate to the billing team. They will be automatically flagged in AccelaSmart to review this note if any information is entered here. Okay? If I'm not ready to see this patient, I can hit save and in progress. It'll take me back, put that patient on my rounding list so that I can go back and enter the charge information when I'm ready. When I'm ready, all I do is click on the in progress button, brings me back to the encounter. Then I can add my diagnoses and procedures. I don't have any to start with. I just have my favorites list. Again, a short favorites list here. Yours may be longer than this. So if I have a patient with kidney failure and a urinary tract infection, I can select those. Now, I could select them and go back to that encounter summary screen, but I'm not going to do that. I'm going to save myself a step and switch over to the CPT list. So I can select my CPT code. I'll click on it. Brings me back here. Again, I can do my linking. Once I'm done, or if I want to come back and finish it later, I can use the save and complete, save and in progress buttons. As a physician, you're done at this point. You don't have to sync it. You don't have to send it. You don't have to drop off the scraps of paper for the billing team. They have immediate access to this information so that they can take it through AccelaSmart. The billing team can review all of their edits, make sure that these charges are posted quickly and completely the very first time, so that they're not having to follow up with the doctors asking for those hospital charges, and the doctors don't have to remember to keep up with it or drop it off after the end of a long day. AccelaMOBILE can fix those problems for your practice. But remember, the key to making that work for your providers is to make it easy for them. Don't ask them to do a lot more than what they're doing today. If somebody else is managing the rounding list for them in a paper-based world, continue to manage that rounding list for them in the electronic world. That makes for happy physicians. It makes for happy billing teams. Okay, now I know I went through that information